Dr. Mora. I just wanted to share a very interesting case with an important message. Okay, I know it's hard to understand what this is, but this is the inside of the knee. This is the medial meniscus. This is the medial meniscus towards the back, and this is the top of the knee, or the femur bone on top, and the tibia below. And you can see this is a rip right over here. It's a rip through the meniscus. It's an oblique type of tear. It's in the back. It's very near the root. It's actually a type of root tear. The bottom line is when you have any disengagement of the meniscus from the bone, what it basically leads to a totally dysfunctional meniscus. And this is what happened to the 72-year-old lady. She was doing fine, and then all of a sudden she experienced severe knee pain. Now look at the rest of the knee, okay? Let me just show you the rest of the knee. You can see there's some arthritis in the knee, which is what you expect in a 72-year-old person. Arthritic changes, but this is a person that was extremely active before this happened. And let me show you the patella. The kneecap was actually exposed bone. But the key to taking care of these folks is not so much the arthritis, but how they were before the incident and where they hurt. It was medial knee pain, severe. The patient couldn't even walk, and that was the tear. This is the surgical picture. This is me placing a suture through one part of this oblique type of radial tear. I put another suture right over here, similar to this, and then I made a drill hole right here, and that way this part of the meniscus was reattached back to bone, like that. There is the actual root attachment. The tear was over here. The drill hole is right over here. A little bit different than your typical root repair. Okay, a little bit different than your typical root repair. There it is. Perfect. And now the whole meniscus is working in unity. And when downward pressure is applied, the meniscus is working. The hoop stress is restored. So how did the 72-year-old patient do? Absolutely amazing. Couldn't even walk before surgery, and within a month was already walking again. How can I prove that to you? I'll show you in a minute. I'll show you the testimonial. But just once again, take-home messages: don't base treatment on age. That's basically it. Don't base all treatment on age. And just because you see this up there, it doesn't mean that they need total knee replacement. This is Dr. Mora showing you a case that I call a joint sparing procedure. Thank you very much. You guys have a great day.
I had my surgery on April 15th. Before the surgery, I could hardly walk. The pain on the inside of my right knee went all the way down to the foot area. It's been about 8 weeks. I'm walking. Within the next 2 weeks, I'll have complete straightness of the leg and on my way to play golf and pickleball.